From the Soapbox is the official podcast for the American Animal Hospital Association's digital newsroom, Trends. Here, we take inspiration from the familiar soap notes, but instead of looking at the condition of a patient, we're diagnosing and discussing the state of the veterinary industry. We'll chat about the challenges, trends, and innovations shaping the veterinary world with voices from across the community. I'm your host, Dr. Emily Singler. Thanks for listening. Hey everyone, welcome to another episode of From the Soapbox. My guest today is Dr. Michael Blackwell. If you're not familiar with him, I'm so excited for you to get to meet him today. I personally learned about him not that long ago, and as I was preparing for this episode, I was just blown away by his background. I'm not going to go into all of it now because he walks us through a lot of it during our conversation, but suffice it to say, he's had a long and distinguished career as a public service veterinarian, dean of a vet school, and now director of the program for pet equity, working on access to care for pet-owning families. We started out talking about social work since March was Social Work Month, but our conversation also branched out into other areas of One Health and access to care, and how veterinary teams can reframe their thoughts when it comes to clients being able to afford the care we recommend. There's so much good stuff in here, and I really hope you enjoy it. Without further ado, getting his time to talk from the soapbox, Dr. Michael Blackwell. Dr. Michael Blackwell, thank you so much for being here with me today. I'm so excited to get to talk to you about veterinary social work and your career and just all the amazing things you're working on. So thank you so much and welcome.
Thank you so much, Emily. I'm happy to be here, and thank you for the invitation to speak with you and your audience.
Well, I wanted to start out by learning a little more about you. You have such an interesting and impressive resume. I was going over it and I was just completely blown away. I don't think I've ever seen anything like it before. And just between your long distinguished career in public service, your leadership at the University of Tennessee College of Veterinary Medicine, and now your role as the director of the program for pet equity, could you just share a little bit of your journey, kind of how you got to where you are today, from starting out graduating as a veterinarian to where you are now?
Sure. I'll actually start a little bit before graduating. My dad was a practicing veterinarian at the time I was born and grew up. He had a general practice in Southeast Oklahoma. So I've been in this profession all my life. Um, I grew up thinking that I would go to vet school and come back and join him in practice. However, during my senior year of high school, he decided to leave practice after 18 years and joined the faculty at Tuskegee University, College of Veterinary Medicine. So I did go to Tuskegee, his alma mater as well, and practiced for a few years in Oklahoma right out of veterinary school. But during that time, it was clear that I was being called to do something different, something more. And this came as a surprise because all of those years I was expecting to be this general practitioner. That's what led to me joining the United States Public Health Service, the Food and Drug Administration specifically. And I actually thought that would be just a stepping stone until I kind of figured out what I wanted to be when I grew up.
Mhm.
However, I found the work to be so appealing and inspirational, actually. Um, and I think I should say this at this time. I took seriously, as so many others in public service do, the importance of working on behalf of our nation. There's a special feeling that comes about when doing that kind of work, and it's not very different from what it feels like to be in private practice and serving the needs of clients. And so that started me on a whole different career path of public service. And after 23 years of that work, I accepted the offer to become dean of the veterinary college at the University of Tennessee. Interestingly, that was also a mission. I didn't grow up to be a dean. What
Right.
is a dean anyway, right? Um, no, we were, heavily involved in, national security planning because at that time in the late '90s, the intelligence community was saying to us that, the country was likely to be attacked within 5 years, and, of course, I was in the Department of Health and Human Services, so our focus was on, bioterrorism. And the position of the United States Public Health Service was that veterinarians were critically important in protecting the nation's security because of zoonotic diseases being the most likely agents weaponized and used in an attack. So, becoming a dean was in part to ensure that, at least at that college, we started to focus on public health more than we were. I think medicine really took front and center role in veterinary medical training. So important. That's what the society needed from us as a profession. But it felt like we were also abandoning our public health mission. So that's how I ended up becoming a dean and um, spent uh, just under 8 years in that position before deciding to focus on access to veterinary care. And that came about because of a number of factors, but the 2008 recession was a milestone period where so many families were dropping out of the middle class into the working poor class, if you would, and of course, that started to significantly impact our ability to reach these clients because of finances. And so therein is how I got here. One other thing I decided was important, though, while I was dean was to see a formal relationship built between our profession and social work. And well, where did that come from?
Yeah.
It turns out my last position with the United States Public Health Service was chief of staff of the Office of the Surgeon General. And during that time, we were producing the Surgeon General's report on mental health.
Mhm.
You know, Emily, it occurred to me because I was still practicing at the time how often we as practitioners are looking across that exam table into the eyes of depression and anxiety because of what's going on with someone that person loves, the pet.
Right.
And I felt so ill prepared as a practitioner at that point. You know, we're not trained in mental health and some of the deeper nuances of what it means to minister to people. So veterinary client patient relationship and that client piece, it took on a new meaning that, we we have a responsibility to minister to our clients, but it doesn't mean we do the work or become the professionals who minister to them in all ways, but it meant partnering with an allied profession that would work with us.
Wow, that's so amazing, that journey. I mean, I see sort of the threads and the trends of your career has been devoted to really serving our country, to serving our veterinary profession, to serving pet owners, to just service of people. And of course, as veterinarians, we focus on the animal as well. But such an important reminder that obviously we are there to serve the humans every bit as much as the animals. And while you were talking, I was just reminded, my time in clinical practice. I mean, we hear so many intimate details about pet owners' lives that you're right, we're just not really formally trained or prepared in any way to know how to respond to. And I think we often joke about how, we play so many different roles in the workplace and we start to feel like sort of pseudo therapists some of the time with all of the information that's disclosed to us about the lives of the people that we serve. And what a great resource to be able to have veterinary social workers, to have individuals who are trained to help us and to help those individuals directly. So I'm very excited to learn more about that. And I also just wanted to say thank you so much for all your service to our country. I know that federal veterinarians and public service veterinarians, they do such amazing work.
Well, thank you. You know, our society, has asked a lot of us, and I go back to the early days when I was growing up, and at least in Oklahoma in that practice, animals were, important to people, and agriculture, of course, for their own, uh, financial security and so forth, and there were clients in my dad's practice who, clearly were bonded to their pets. But just as the public started asking more of us as far as medicine, surgery, advanced techniques and interventions, be what drove that? Well, there was a bond that was going deeper and deeper, and it was becoming way more prominent, in our society. So, for example, today, 2 out of 3 of our households have pets in them, and 97% of those households consider their pets family members. They are literally family members, and that family behaves like that pet is a family member. And just for reference, less than 4 out of 10 of our households have children in them. So the family unit evolved in this country to become a more biodiverse unit, human and non-human family members. Well, while we were getting better and better and better at ensuring, their health and well-being through medicine and surgery, um, what was coming along with that was this whole mental, emotional health component because of the bond, and, and so this is a good story. It's a good thing, but it also means that we've matured as a profession to the place where we cannot do this as well as we need to operating in a siloed way, where it's just within the walls of our practice and whatever's going on outside of that wall or even across that exam table is not our issue. No, it is because we can be better practitioners to the extent that we are in a system which needs to form, but a system that is actually helping with the client piece.
And veterinary social workers are an important component of that system, you would say.
Yes,
Yeah.
they are because they are trained to understand where a person is in a given moment or situation, and then work with that person to connect them with needed resources um, or help. And, in a sense, they are generalists, not all, because they also have specialties, veterinary social work would be an example of that. But, just as we're generalists, because we treat all species other than humans, and we see all sorts of things, and we're dealing with a combination of agriculture to family members and so forth, this the social work profession is best suited as, having a more general comprehensive perspective as well, but being focused upon the humans.
Great. And kind of on that same topic, can you share some of the ways that you interact with veterinary social workers, that you have interacted with them throughout your career? I imagine you interact with them a lot now in your current role. What are different some of the different scenarios in which you've interacted with veterinary social workers?
Sure. In a clinical setting, One of the easiest, examples would be end of life decisions, and, we understand that a person may struggle, to, come to a decision about euthanasia. Now, th often there's a guilt operating there, a guilt feeling guilty about abandoning a loved one, feeling super, super, super responsible for the life and well-being of that individual. I mean, there are justifiable reasons why people may be struggling in that moment, and very commonly, we encounter the case of someone having already lost a loved one, and here's the remaining loved one in the household. So, our system of care delivery is based on, some might say, very limited time in the exam room. We may have these 15 to 20-minute appointment schedules and so forth, and, business operations day in and day out, are going to operate efficiently to the extent you can adhere to that.
Right.
Yet, in ministering to that client in the exam room, it is clear they're struggling with a decision, and we believe the pet is in a situation at this point where euthanasia is the most appropriate thing. It's the merciful, loving thing to do. We may be inching our way to the door of that exam room because we've got the next patient waiting for us. And I think most veterinarians probably don't feel comfortable um, in that moment because it feels like maybe you're abandoning that person, that they really need a longer conversation, if you would. Well, if we're in a system with allied professionals, someone with specific training in such matters can take over that conversation and work with that client, not necessarily in that moment in the exam room. That person might be someone you refer that client to have a conversation with. But in the process of another professional working with that client, that individual may be able to get down to the bottom of what the barrier is. And maybe it's not the case of the client not understanding the importance of the decision as far as, well, my loved one is suffering. There's no good outcome involved here. Why am I not able to come to that decision? So that's one scenario that I think plays out very, very often. And I personally would be relieved knowing that that client was placed into the hands of a professional who would work with them so that when the decision is finally reached, we got there through a method that actually ministered to the client, and it enabled me to perform that procedure, knowing that we were all on the same page. And as bad as it is, it was a good outcome in the end. Um, So, and then when we add the whole access to veterinary care piece, that's a whole nother level of complication that we're struggling with. Um, where if we were operating in a broader healthcare system, we would get a lot of help from the financial side to what I just talked about, administering to the client.
I think another, when you were discussing sort of that process of kind of ushering the client through, I can definitely think of instances in my own time in practice where there was at least a concern that the client may have felt like they were being kind of rushed through the decision, like
Yeah,
you said, because
yeah,
you've got to go on to the next room, you maybe need to be told the same thing over and over again to sort of assuage some of these feelings of doubt or guilt or whatever it is. You need time to kind of sit with those feelings, but just that sense that the veterinary professional doesn't feel like they can they can stay in the room and provide that, and perhaps the client picks up on that sense
Yeah.
of, "I'm
Yes.
holding you back."
Yes.
And I don't wanna feel like I'm holding you back when I have to make this irreversible, potentially irreversible decision. So having someone who can make them feel like they do have the luxury of some time, and, being able to kind of talk that through,
Yes.
um, sounds so valuable to me. So I'm really glad that you brought that point up. And I'd love to hear kind of more about the program for pet health equity, and maybe how, um, just what some of the goals of that program are, and how social work kind of fits into that mission, because it's not something that I had heard about. Maybe others may not know very much about it either.
Yes. So, what is equity anyway? In the case of health equity, what we're basically getting at is pet families have certain needs for essential services. Veterinary care would be one of those essential services. But housing, transportation, when we think of the things that a typical family needs in order to enjoy quality of life, what we see right now is infrastructures across the country, community infrastructures, are not adequately aligned to support the family. So going back to what I said earlier, the society evolved into these biodiverse family units, but the systems to support families are lagging behind this evolution. So we see people, for example, the most extreme example would be unsheltered. They live on the street. And so many of those individuals don't want to live on the street, but they happen to not have access to a shelter that will allow their family member to come with them. Uh, in the cases of natural disasters and disaster response, and Katrina really made this point big for many who are not seeing it. But people put themselves in harm's way because they're not going to abandon their family member. I'm going to run over here and save myself, but leave behind not only someone I love, but maybe someone I depend on for my own mental, emotional health, well being, security, joy. So, our work is about bringing about adjustments in how this country supports families. It's not a wholesale, let's get rid of all the programs and then build new programs, but rather let's tweak, let's modify the existing support services from social service to the public health programs and so forth, so that pets a priori are factored into the program planning and implementation. So I hope I'm making sense here. We're
Yeah,
just
I
out of
kind of
line.
understand. It's more kind of like at a system level, you're sort of evaluating the systems that are in place,
Yes. Yes.
and finding ways that pet ownership can be factored into systems and programs
Yes.
that already exist.
Yes. And so we're doing that through multiple strategies. For example, we launched back up. So what we've identified is that there are four sectors that would represent these essential service needs of pet families. And that's from healthcare to financing, how they, you know, from credit to other forms of getting support to purchase these essential services, to housing and transportation, and also research and public policy arena. So, four sectors have been identified. We're inviting individuals from all four sectors to join the One Health Forum that we set up and launched in October of last year. We are planning an annual One Health Society Summit. The inaugural event will be next year, 2026. But that will be, again, to invite, this diverse community of, disciplines, professions, industries to come together and in a typical fashion of a convention, presenting papers, holding panels, networking, all with the intent uh, uh, of bringing about a more collaborative approach to supporting our society, the families in our society, which are biodiverse. And of course, we intend to launch a journal for the researchers among these various sectors to be able to publish your work and centralize that work. So what would pop out in the end when all of this gets done? Veterinary medicine will be living in a one health system in contrast to what feels more like living in a silo. We do great things, and I've seen such heroic efforts on the part of our it's not only veterinarians, but the whole veterinary care team, just driven by love and compassion and the determination to solve problems. But too often, we are trying to fix it all by ourselves, and we can't fix society by ourselves. We need to be in a system of, a One Health system that actually is working, with us, if you would. And I think we'll get there because the interest is broad. So, for example, this is not just me as a veterinarian thinking this way about the need, because whenever we hold conversations with anybody in the other disciplines, sectors, industries, it turns out, boom, they immediately get it. Now, why would they immediately get it? Because they live in the same society that we're seeing where most of our households are. They're living that lifestyle. It's just that people have not given the attention that we are intending to bring to this need to better align what we have as resources and activities in this country to better support our pet families.
AHACon 2025 is more than just continuing education. It's your chance to take your career to the next level. Earn race approved CE credits, engage with industry leading experts, and gain fresh perspectives to bring back to your practice. Hear from powerhouse speakers, plus enjoy unique experiences like live pet portraits, charm bracelets, professional headshots, resume reviews, and much more. September 11th through 13th in downtown Chicago on the Magnificent Mile. Don't miss this transformative event. Learn more at c.aha.org. That's the letter c.aha.org.
I think that's so heartening because, I mean, I guess I can't speak for everyone, but I feel like a lot of veterinary professionals, myself included, have wanted to be part of this system, this generalized One Health system for a while and have felt I don't want to say ostracized, but maybe sort of just not included, not thought of as an integral part. I mean, when you think of the other healthcare professions, there's often not a lot of acknowledgement or understanding of the role of veterinary medicine among healthcare professionals. I mean, back to just your career fighting bioterrorism. I mean, zoonotic diseases. Who better to understand mechanisms of action, transmission, and the importance of zoonotic diseases than veterinary professionals, alongside other healthcare professionals,
It's
and other disciplines. So
yeah,
that's very exciting to me.
we historically are a conservative lot. We, and especially around social issues. Uh, there are a lot of reasons for that, and it probably starts with who gets called to do this wonderful work of being a veterinarian. Um, some would say we have a great showing of introverts, and but we are We are
True.
clearly, de great decision makers, problem solvers, but yet conservative. What would happen, do you think, if we intentionally added our voice to a call for action to address this? Now, let's start with, well, why would we even be doing this? Because when we think of pet families, we are the most, or at least among the most significant advocates for the well-being of pet families. But now, in order to do that, add our voice, I think it's immensely important, and especially for our colleagues who are in companion animal practice. We just acknowledged that what you're doing is treating family members. So, one paradigm shift that is extremely important as we choose to put our voice forward toward these issues is that we first do an introspection and understand, oh my God, I'm actually in family healthcare. I'm a family healthcare professional. It is no different than a pediatrician who focuses on the minors in that family unit. It is no different than the geriatrician who's focusing on the seniors in that family unit. Why is it that we would be viewing ourselves as any different? Yet I think we're not there. If we were to assume and accept this reality, and it's already the reality,
Mhm.
then our voice is not only going to be stronger, but we will be speaking in a way that will resonate with the broader healthcare system and the broader social service system and so forth, making it family centric, not pet centric, not animal centric, family centric. Doing that will enable us to do a better job of reaching our patients and administering great care to our patients.
I 100% agree, and that makes me think I'm sure you're familiar with the community care guidelines
Yes,
from
I am.
AAHA.
I actually
Um,
help work
y
on that.
we worked on them, yes.
Mm,
And, the idea of family-centered care is really a central component of those guidelines, and I still think of it as, family-centered care from the standpoint of how we best help make decisions about the healthcare for the pet, which needs to take into account all the needs and the resources and the um, abilities of the entire family unit. And but I still think of that as being focused on, the outcome is obviously keeping the pet and the family together, helping the pet be as healthy as possible, and helping the family to have all the benefits of continuing to have that pet in their family. But I feel like what you said even takes it a step further, the being part of the family healthcare team, really seeing ourselves as we are not just there for this dog or cat who may live in this household and be loved and cherished and treated as a family. We are an integral part of keeping this whole family, of keeping our society healthy and functioning and thriving and, mentally doing well. So I love that, and I think that veterinary professionals haven't necessarily felt welcomed to sort of occupy, and I'm sure some of it we put on ourselves. We kind of self silo and think this is what I do. This is all I do. I don't have any connection to any of the rest of it. But to feel welcomed really into that, to say we are so important in terms of what we do, not just for the animal, but for the family, and then broadly for society as a whole. I love that, and I think we need to hear more of that and be more open to embracing that, because I think everyone is going to benefit from that.
Well, one other important driver here is for us to understand, yeah, in part, this is compassion based, and compassion is very, very important. That's who we are. We can't help that part. But are we failing in our public health mission? So if we look at the fact that we've got tens of millions now of pets that don't have adequate access to veterinary care for a host of reasons, but those reasons are based on the reality of their family, financial in particular. Um, then that means we are not able to prevent and control zoonotic diseases. And we know there are a number of zoonotic diseases that are increasing every year. We know that with this change in climate, we're seeing a growing population of vectors, and they're migrating further north into new areas. We should be sounding an alarm bell about this. Hey, society, we need to make sure that we develop systems, tweak our systems so that we ensure access to veterinary care. Because here's where we're headed if we don't do that. And I just think our voice is respected still, especially relative to other healthcare professionals. At least that's what the data tends to say. And that's what we call privilege.
Yeah.
And there's power in privilege. So, what are we doing with that power? Are we exercising that power in a way that we actually benefit society?
We certainly should be.
Yeah.
Certainly should be. Yeah. So that's such an important reminder. And to bring up another AHA guideline that'll be coming out soon, the One Health guidelines. I'm very excited about those because I think this is the first time that we're going to have MDs and other specifically human healthcare practitioners on the task force. I mean, really brought them all together to discuss ways that veterinarians and human healthcare practitioners can work together to support One Health. And I think we need to see a lot more of those conversations.
Yeah.
Um, so
Well,
it's exciting to me
I
that it's starting to happen. But
yes, I had the honor to also help with that project. And let me just say, organized veterinary medicine is important for reasons that we all can speak to. But in at this time, in this moment, we need leadership around these kinds of issues. And AHA has established yourselves as the foremost among organized veterinary medicine organizations that's pushing forward and bringing these issues to the front. So I really, really do applaud what the association is doing and believe it's going to be very, very much a determinant for a brighter future. We need others to enter this space as well, but please, AHA, keep doing what you're doing. We've looked to AHA as the standard setting entity in veterinary medicine for so long as a respected organization. That's what I'm saying. That's a privilege right there that's being exercised. The power that exists is being exercised. It takes things like that. It's actually not very mystical. It's really straightforward, but it requires an organization deciding, yeah, that's important, and we're going to take specific steps to help drive the conversation forward and challenge thinking about how we're going about doing what we do.
I agree, that's so important. I haven't been directly involved in the guidelines in any way, but I'm so happy with the decisions that have been made to go in the directions that we're going because I think it's essential to moving forward and progressing for the sake of animals, for the sake of humans, for the sake of our profession, society as a whole. I'm very excited to see those guidelines when they come out. Um, And then kind of getting back to the idea of veterinary social workers as a part of all these systems that we've been discussing, as a part of, kind of maybe in some cases bridging some of the links between uh, human healthcare and veterinary care, or veterinary care and sort of the daily lives of the pet owners that in companion animal medicine that come through our doors, every day. um, One of the things in my research that I've sort of struggled to find the answer to is independent practices per se. We see these big corporations will sometimes have a veterinary social worker on staff who maybe is not present physically in every hospital every day because they can't be, but they are available, they can be reached, they can make presentations to teams, they can interact with clients, that kind of thing. But how do smaller independent practices who maybe don't have a veterinary social worker on their staff, like how can they interact with one? How can they benefit from their services?
Sure.
Um,
That's a great question. I would strongly encourage a group of practices. Choose your jurisdiction, but let's just use a number. You could get 5 practices that decide to collaborate in a joint sharing of a single social worker. May not be a veterinary social worker because their
Mhm.
numbers are limited. The numbers are growing, but, just starting there, and if you think about the cost to the individual business to support a 20% effort by a
Mhm.
social worker, now you are starting to actually put in place structure and a system by which that service becomes available. Again, you don't have to do it all on your own within your own walls and figure it out all by yourself, but start thinking on a systems level. Um, I would start there. I think VMAs, especially at the local level, should be discussing how to go forward and do that. The social workers are out there and increasingly are understanding that in order for them to do their job, they need to recognize that these families that they train to support, or individuals more often than not, have a pet in the picture somewhere. So they're needing to catch up with where society is as well. But that would be a very straightforward, practical way in which an individual small business, pri- private practice
Mhm.
could access the services of a social worker. I guess nothing is free in life, so it would involve, and social workers, unfortunately, but in this conversation, maybe fortunately, they're not real expensive. So it is not a major financial hit if you're sharing that position. Now it can get complicated. One practice can be consuming, 50% of the person's effort, but pay only 20% of the cost. I mean, there are some details that would need to be addressed in working out an agreement, but it's doable. It is
Mhm.
very, very doable, practical approach.
I spoke with a veterinary social work. I guess she doesn't officially have the veterinary social work certificate, but she has chosen to um, dedicate her practice to working with veterinary teams. So, in that sense, she refers to herself as a veterinary social worker. And she sort of contracts remotely with practices all across the country who will need her services for a presentation, for a meeting to discuss a particular conflict or that kind of thing. Are there many social workers out there that you know of that are practicing that way? I know you said numbers are still low.
I don't have a specific number. Last time I heard a number, it was because I don't manage the veterinary social work program, but it, there were less than 500
Okay.
veterinary social workers,
Right.
and that number probably represented the international. um, census. Um, the numbers continue to grow. The University of Tennessee is still the only university, as far as I know, that's certifying social workers in veterinary social work. Uh, I do understand also, though, that there may be as many as 10 other universities that are looking at implementing programs. And and so we definitely have a situation of lack of availability or numbers. But there again are social workers who live the lifestyle or who are encountering these families all the time in their regular work and know that the need is there. I guess it's one of those situations that if we as a profession ask, we would likely get a response, whether it's asking a social worker to provide services or whether it's asking this nation to develop the systems that's needed to better support families and to safeguard family health and well-being. Um, so, yeah, the numbers are small, but we can get there. I think it's going to operate exponentially through time because more and more people now are very sensitized to this need, not just in veterinary medicine, but beyond.
I like that. The numbers are small, but we need to potentially go out and ask and look, and we'll probably find someone who maybe they don't have the exact um, qualifications where they're looking for a veterinary practice to begin with, but would potentially be very open to the idea and very well suited to do the work.
Yeah. If we ask, we will receive. I've I'll put it that way. Um, Going back to the silo and then not being integrated so well with the rest of the healthcare system and beyond, and maybe feeling at times that we are not well appreciated, um, despite that history and all, we're living in a different time. W and the audience that we're speaking to is that society that know how much, um, pets are part of our world. They may have to be prompted to think about that, and who's to prompt them? Is it gonna come from within their own ranks, or maybe they need a pet advocate out there who's prompting them to think about these things. That's the work we do, and we think, the profession at large needs to start doing. I do need to address the elephant in the room, though, about access to care, and, the elephant, of course, is if a person can't afford a veterinarian, they probably shouldn't have their pet. Um, and I wanna share a story. One of the families that, we worked with that lives out in Reno participated in a focus group and shared the story of how they ended up being able to get help through our system, Align Care. And this mom sobbed as she told her story, but the dog had had a medical problem and it was serious. And she didn't have the money to pay for the veterinary care. So for a couple of days, she had sleepless nights and wrestled with how she was going to explain to her 12-year-old nonverbal autistic son that the dog was going to have to be euthanized. It turns out that the dog is the only individual on the planet that this child interacts with, and she she was horrified at what the impact was going to be on his life. But fortunately, this story had a good ending. She was able to enroll in a lawn care out in Reno and got the medical care that was needed. I guess what I'm saying is, uh, dogs and cats in particular, but it extends to other species, are not just property as the law defines them. They are family members. and they're having an impact on families in ways that may not be on our radar always. And it's for these reasons that I think we want to be careful about judging whether someone deserves that relationship. Plus, in our oath, we said we were going to use our professional knowledge and skills to benefit society, not to judge who your relationship should be with and who you should choose to have family with. Thank God we don't have that responsibility, right?
Right. Yeah.
So let's just get rid of that and say, it's not my job to decide the relationship. My job is to help preserve the health of that relationship to the extent that I can.
Looking for the latest veterinary news? Stay ahead of the curve with stories from the American Animal Hospital Association's digital, award winning newsroom, Trends. We're bringing you fresh stories every day, covering everything from the cutting edge clinical insights to helpful practice management tips. And it's not just articles. Watch videos, check out interactive charts, and learn more about the people shaping our industry. As an AHA member, you also unlock exclusive members only content designed to help you and your team thrive. Visit aha.org/trends today and sign up for Trendsetter, our newsletter where all of our stories are delivered to your inbox twice a week.
I love that. That's such a great way to reframe that. And I know some of that argument probably comes from some defensiveness, some sense that we're being judged or criticized for having to charge for services. And I certainly get that. But it's such an important reminder that the client who is either complaining about cost or says that they can't afford it or says that it's too expensive, however they word it, they're not our enemy.
No, they're not the problem. The problem is lack of a system that supports families in these areas. So, and when we think about most people who do acquire health care, very, very few are paying for health care out of their pocket 100%. We all are depending on assistance. Usually it's insurance, and maybe public insurance or private insurance, but it's some form of assistance. Well, we deserve and need to be paid the fees that we must charge in order to provide quality care. That's not the problem, and it shouldn't be allowed to be made the problem. The problem is the country has not kept up with the evolution of the family unit and ensured that the systems of financial support are there for the medical care of those non-human family members. And I think we will get there. Um, when somebody points me to the law and say, "Well, the law says they're just property," let me just respond this way to that. The plants behind me are personal living property under the law, just as a pet would be personal living property. I can kill all of those plants back there in front of the entire public, and nothing will happen to me. I can do the exact same thing to a pet, and I can go to jail. So society is not overinterpreting this, well, they're just property thing. We need to get past that as well because the law hasn't caught up either, but it is changing and it will change. We see that with court cases already where custody is concerned. And of course, Connecticut was the first state to establish court appointed representatives for pets. I mean, this is where we're headed. And that's because society has shifted. So, um, we've got to overcome some concerns about liability and so forth. They are real and they need due attention so that we protect ourselves, but society has shifted on us, and I'm not sure we're always standing in sync with where society is. So, again, we can't fix this by ourselves, but we can certainly call for um, the fixes to take place. And I think change I know it will happen. I'm very, very convinced of that.
Yeah, I mean, we can't figure out all the legal ins and outs of what should pets be called, how should they be considered, that kind of thing. But we can still act in accordance with what good ethical treatment of animals and pets
Yes, that's
entails.
our job. That's our job, and we be consistent with our job and not sign ourselves up to attend to mental health, sign ourselves up to attend to legal issues. Um, but we certainly can say um, we can't safeguard public health when we have so many that don't have access to care. And that's the driver. It's not about compassion. It's as important as that is. It's us carrying out our mission to safeguard the health of the public through disease prevention and control.
Yeah, that's such an important argument. As important as compassion is, there's another huge driver for it. So in terms of veterinary social work being a very small, relatively small field at this point and its importance, even though I think we've established that there are plenty of social workers without this specific certificate who can do a fabulous job of
Absolutely.
of supporting our industry. Um, I know you mentioned other universities looking at offering a certificate. Like how do you see veterinary social work continuing to grow?
Two things. First of all, right now as we speak, thousands of social work students sitting in classrooms. They will not be adequately trained to go out and serve the public and serve society if that is done in isolation of the reality that these family units are biodiverse. So I think the social work curricula will change accordingly. For example, social workers commonly are helping people with housing. And if you're out there spending all this time and effort to connect this individual with housing, um, what you don't want to do is spend that time just to have it fail because you didn't factor in the pet and you're trying to link them up with housing that will not bring their pet. Um, that does happen right now, and then sometimes the family breaks up. In other cases, they just refuse to make a change. But if they're in insecure housing situation, something bad is going to happen if you have not been very um, uh, effective in recognizing their makeup and therefore acting accordingly. It's just little things like that. People who won't go in for health care that they need as a human because they don't have options for their pet. They can't leave the pet at home locked up. They don't know, maybe don't even have the financial resources to board or to do some of the other get someone into the home to take care of them. There are these realities that social workers are bumping into right now as we speak. Their curriculum needs to reflect that's the society that you're going out to serve. A subset of those students would hopefully go on to get the specialized training as a veterinary social worker because that training will become really more focused on, well, what is a human that's connected with a non-human and a human animal bond situation? And what are the kind of issues that arise besides the clear cut housing or so forth, the emotional issues? Um, so I think they're gonna have to change for the same reason that we are. It's catching up with where society is in order to do a better job of ministering to that society.
And do you see the numbers just with all these potential schools? I mean, do you see the numbers kind of starting to explode in terms of availability of veterinary social workers, or do you think that'll be a slow?
I don't have a good feel for that. I do know that the work of the Program for Pet Health Equity is intended to make this a very prominent um, point of discussion among colleges and schools of social work. Um, because I think once the message is clearly received, and given that they're driven by compassion too and wanting to be good at their jobs as professionals, the rest will take care of itself. They'll make the changes that they need to make. Uh, Again, the call needs to come out of veterinary medicine because we're most in touch with what's not working well with these families. And legislators will have a role here, policymakers. Um, there are a lot of seniors who are very thin and struggling because why? They're sharing their food with their pet. And if that pet were not in their home, we know that their morbidity and mortality rates would go up.
Yeah.
And that's an increased cost in the healthcare system for others. I mean, i- it's I see a picture where we're so close to being able to be in a better place, but, the numbers are not there, but the will is there, I believe, or will be there as, the messages are made clear. And what AAHA is doing through these guidelines, while directed at veterinary medicine, hopefully will have broader, um, utilization, in these other by these other disciplines.
Hopefully, yeah. In terms of like veterinary professionals, like speaking up and asking, like what are the best ways for them to do that? Is it being involved in their state VMAs, AVMA, reaching out directly to their local legislators? Like,
I think the veterinary profession needs a strategic plan, if you would, or a plan that first starts with what we're talking about. Do we see the problem? Do we agree that the problem is not only there, but needs attention and that we have a role? And then coming to understand, well, what is it? What is our role? What should we be doing? We're not going to start lobbying and so forth, and doing some of those sort of things. But in what ways can we strategically message to the right people and in the right ways that not only brings attention to these issues, but drive change? So individual veterinarians can do certain things, but this is where organized effort has its place. Um, and if we chose to do that from an organized perspective, that starts with AVMA, but it expands to state VMAs and all the way down to local, or regional. That's the way I think it should go. I'd love to be sitting in a room or at least know that people are sitting in a room where the conversation is about, are we ready to sign up to do anything about this? Do we have a place? Do we have a role? And if we agree that we do and that we should, for whatever set of reasons we develop as the real reasons for wanting to be involved in pushing for change, and it's change that we don't have to make by ourselves, you understand? We're talking about these sectors that support families. Then developing the messaging and developing a strategic approach to getting that messaging out. Um, that's what I think we need to be doing.
such an important call to action, and
Yes.
so happy to have you at the helm of the Center for Pet Equity, continuing to lead some of these efforts. Obviously, we all need to be part of it. Um, but so grateful for the work that you're doing.
Well, thank you. Going back to our strategic efforts, that's what we intend to do is um, stimulate the discussion among the various sectors, and veterinary medicine is part of the healthcare sector. But um, we're we're going to do our part to try to accomplish what I just said. I think we need to be doing from an organized veterinary medicine standpoint, and I think the profession is going to get there. I'm really optimistic, actually, that will happen. Um, And it will happen because of sheer need for change to take place.
Well, on that subject of optimism, I wanted to close by asking about what's one thing that you're excited about in our profession? Either something that's already happening, something you're looking forward to in the future.
It's access to veterinary care. First and foremost, that it is clear veterinarians are aware that we have a problem with so many families not having access, and that they care about the fact that those families don't have access. So the fact that there's so much discussion and attention to this topic is means everything, because who are we? Well, we are a group of people who were blessed with intelligence coupled with compassion. And I mean, if you allow us to see the problem, we figure out a way to fix the problem. That's who we are. That's what we do.
That's for sure.
So
We don't need to have all the fancy equipment or, brand new supplies or anything like that. We
exactly,
will make
very
it work.
creative, innovative about it. Yes. So we see the problem. Just that alone tells me, oh, you got the wrong group on this if you didn't want this fixed. So that's where my optimism comes from. But I also see a society that is pressured now to find alternatives to the way things get done, and that's because of the socioeconomic um, trends that continue. Meaning 41% now of our households are ALICE, asset limited income constrained, but employed. The working poor are in poverty. Almost half, 41%. And so these systems failures that I've been talking about, these systems were built largely for the middle class. And because of the changes in the demographics of the country, pressures are going to come from all quarters to bring about changes. And so, what we are simply doing is ensuring that all of these efforts understand that the family unit is a biodiverse unit, and we're taking care of the medical part for those non-human family members, but they've got financial needs and other needs that society needs to also address. Yeah, so, um, uh, I'm optimistic. It's out of not just moral championing things for academic reasons, it's out of sheer need that change will happen, and it's gonna favor us, um, and our efforts in the end.
Thank you so much for that. I think that optimism is very, very much needed right now. You've definitely inspired me. I think we need to all keep kind of sharing that optimism and motivating each other through all the challenges that we're facing.
Well, thank you for having me. I've enjoyed our conversation, and just know that I admire people like yourself who are helping with the messaging. This is what it looks like. Um, it's a service that sometimes gets missed. So thank you for what you're doing.
Mm. Well, thank you. I feel like it's the least I could do, but um thanks for your time today, and I'm looking forward to the rest of our community hearing what you had to say today.